So, welcome everyone. Due to popular demand, we're going to discuss peripheral neuropathy, and I'm really, really excited to give you this session. Now, as you can tell by the picture here, which I obtained off the internet, um, peripheral neuropathy is a sensation that you have. Here's a visual of some of the sensations folks can have. Very commonly, we've all experienced it. Say we laid on our elbow or a hand or leaned against something for a prolonged period of time, and then we get this pins and needles sensation that after a few minutes resolves and we're back to normal. However, for many people, this can still persist, and then it's called peripheral neuropathy. All of this information I obtained from general sources on the internet. So I hope that this session will clarify what the internet describes to you whenever you start Googling for information. Put on your seatbelts. This is a very, very complex topic that I'd like to dissect for you through a discussion, a deep discussion of the anatomy of our nervous system, how we classify the word neuropathy, how are some of the signs and symptoms which give me clues when you tell me you're feeling something, which direction to go in, how do we even diagnose it and work it up, and what are some treatment options, if any, and some research protocols that are available out there for you. So let's define neuropathic pain. So neuropathic pain is a type of pain caused by nerve damage or a problem with the nervous system that's described as burning, tingling, sharp, stabbing, or even numbness, but the numbness wouldn't cause pain. People can have the pain all the time. Some of the time it can come and go. It's usually worse at rest and at night. That's when we can feel a little bit more. And people feel a lot of pain when or they can feel more pain when they are touched gently, like a feather can cause them to jump. Neuropathic pain can be severe. It can affect our daily life, keep us from sleeping or eating well, which can then lead to depression and anxiety. Sometimes it goes away on its own, but in other cases, it can last for months or years. So let's spend some time talking about the anatomy of the nervous system. So peripheral neuropathy is kind of an umbrella term for anything that affects the nerves outside of the brain and the spinal cord. So going back to gross anatomy, here is our brain, which is a semi-gelatinous structure, and it is the source of all of our nerves that are formed from the brain and forms into the spinal bulb, which then leads to the spinal cord. And from the spinal cord are formed little nerves that go into our head and neck and all down our arms, follows along the ribs. The ribs protect our nerves. And then it goes forward into our stomach, all our vital organs, and then all the way down to the tips of our toes. So these are long, long strings of nerves that then go up the spinal cord and send signals to our brain. So it's a two-way communication channel, tells our bodies what to do, and also senses what is out there, what we touch, and protects us in our feelings. So we've got the central nervous system composed of the brain, spinal bulb, and spinal cord. And then the yellow is considered the peripheral nervous system. So anything that affects the nerves outside of the middle, the central core, is called peripheral neuropathy. So you can tell that this is pretty huge territory that can be affected by these abnormal sensations I described on the last page. So let's dissect this a little bit further. So say you see a candle burning or a flame. The normal response is you touch it and you feel the heat and you move your hand away from the flame. So what happens is your hand is set right over the flame. You feel the warmth. It sends signals back through the sensory nerve fiber, the blue, and then it sends a signal to the brain. The brain says, move that hand away, and it sends signals by the motor fibers, which are connected to your muscles, to lift up that hand to move away. So we have the sensory fibers and we have motor fibers, and they have to work together in through the same pathway of these little long yellow nerves. Now, in symptoms of peripheral neuropathy, if your motor nerves don't work very well, you can have weakness, you can't lift your finger, you can barely move away from the painful flame. Or if you have problems in the sensory aspects of your nerves, you may not feel the heat. Or you can get what we call hyper sensations because there's a mix going on here. And we'll describe that a little bit further. So the switching station for these sensations. So let's use, for example, your body wants to move across, say, an area that is rocky, and you're barefoot and you're walking along. Motor set your brain saying, okay, let's get moving. It sends signals to the muscles and you're moving your feet forward. And then you can sense these rocky formations, and they can be sharp, irregular, or it cause you off balance. Well, it's sending signals back into the spinal column through the motor and sensory fibers, and it sends signals to the brain, and your brain says, hey, I think I want to walk onto something a little bit more solid and flat. And then you move towards that and move away from that stimulus. So just know that the spinal cord is your switching station that sends signals back up to the brain so that you can act in a different manner. So here are some medical classifications of the word neuropathy. Mononeuropathy means a single nerve is affected. Think about it in terms of carpal tunnel syndrome, where a nerve is pinched right at the wrist, and you can then feel some pain at the fingers or at the wrist itself. Consider this as it's often associated with repetitive tasks, such as working on a computer keyboard. There's something called cubital tunnel syndrome, where all the little nerves in our wrist bones can get in. One of those nerve bones can get cause a pinch of a nerve, or it can be at the elbow, and we can then get entrapment. So it is something that is mechanical. Bell's palsy can occur with just a single facial nerve affected. And then there's a neuralgia paresthetica, a condition of the thigh related to nerve impingement right at the inguinal canal. So these are pinched nerve syndromes, and that can affect signaling and cause us to have pain or numbness or tingling. Polyneuropathy means, just like the word poly means multiple, and multiple nerves are affected. Mononeuritis multiplex can be an inflammatory condition of just one nerve channel. Autonomic neuropathy, I'm going to go into a little bit further, as well as inflammatory neuritis. More than 20 million people in the US are estimated to have some form of a peripheral neuropathy. And it's actually estimated that this number is double because many people have this and don't even mention it to their doctors because it's been going on for so long. So how do we kind of dissect all of this that I've just given you? There are over 100 types of peripheral neuropathy that have been identified, each with its own symptoms and prognosis. And it varies depending on the types of nerves that are damaged or affected. So remember, the motor nerves control all the muscles under our conscious control, walking, grasping, picking up things, even our talking is motor muscle um, activity. Sensory nerves, we touch, we feel, temperature, heat, sharp, dull, our skin is cut. Those sensory nerves transmit information back so that we don't repeat those activities. It's a very important aspect of our survival. Autonomic nerves is something we don't talk about very much. We think about motor nerves and sensory nerves, but there are nerves that actually go to our bladder. Our heart is a nervous organ, our stomach, every other part of our glands, our esophagus. We are innervated, and and that is an important aspect. We've got nerves going to the diaphragm that help control our breathing, our digestion, our into our skin and helps control our sweat glands. And that is the autonomic nervous system. So we are an interrelated complex web when we talk about nerves. And that's why sometimes when we think about our emotions that are up here, and then we develop a nervous stomach, we can now see the gut brain interaction. And it's not just bacterial. Most neuropathies affect all three types of fibers to varying degrees. Some can be more on one versus another. Some can be mostly motor. Others can be mostly sensory or sensory motor or autonomic. About 75% of the polyneuropathies that affect multiple nerves in our body are length dependent, meaning the furthest nerve endings in the feet are where the symptoms develop first or are worse. In severe cases, it can spread upwards all the way to the central part of our body. In non-length dependent neuropathies, the symptoms can start in our trunk or be patchy. So let's go back to this slide. This is the common start of peripheral neuropathy. If you can imagine, this is length dependent and our nerves start here. And these are the smaller nerves that we have. Also, I'd like to pair in our circulation. Here is our heart. Our heart feeds our brain. It feeds itself first. Our vital organs, the lungs, the stomach, the bladder, the kidneys. And then it sends blood along these same tracks it tracks with the nerves, and it sends nutrients to the tips of our toes. But by the time the heart, the lungs, the kidneys, the bladder, all these vital organs have absorbed all the nutrients, our feet get very little. And this will be important as we talk about causes later. So here's a picture of what I've just verbally described. So sensory nerve damage, you can get unusual sensations, you can get hyper sensations from light touch. When the sensory nerves are affected, it misfires and missignals. So a feather can touch your hand and it makes you feel like it's burning, like as it's shown here. Or sensory nerves can get so damaged that you feel numb or you can feel tingling. If this occurs, and you don't sense correctly, you can be unsteady with your gait. And so sensory nerve damage makes us feel a little off kilter. Motor nerve damage results in sometimes muscle cramping, muscle twitching, or tremulousness. Or when I do your reflexes, you can have absent reflexes. Autonomic nerve damage means you can have some excess sweating, have some heat intolerance or cold intolerance. You can get full quickly, digestive problems. You can have erectile dysfunction. And then this is one of the most common things, orthostatic hypotension. It's dizziness or fainting after standing up. And that's what the signals from our brain just tell the body we've stood up, tighten up all those muscles and send blood flow up is not happening. And there's nerves to our vascular system that tell us to tighten up, and that doesn't happen. And then we can get lightheaded easily. So let's dig into the motor symptoms a little bit. If our nerves aren't connected or sending signals to our muscles can weaken over time and get paralyzed. That nerve deterioration from peripheral neuropathy can result in weakness of our foot muscles or paralysis, difficulty moving the toes, or develop what's called a foot drop, or sometimes hand weakness, and we drop things. If it goes up higher, we can have weakness in our thigh muscles or arm muscles. And those are called from distal weakness to proximal muscle weakness. And there's a whole host of diseases that can affect the motor nerves that I would then look for. Muscle atrophy can happen. So if the nerve connection to one specific muscle is impacted, then that muscle can shrink as well as weaken. This again tends to happen in the feet and hands with peripheral neuropathy. Sometimes there are deformities of the feet and hands because of the muscle loss, or you can see some cramping of the tendons happen and pull the feet, pull the bones in. Uncontrolled muscle movements can happen. Sometimes the nerves that lose their connection to the brain because of the peripheral neuropathy then become hyperactive on their own, causing those cramps that I mentioned. Now, sensory symptoms we've described before by image. So it can be tingling. And so then the nerves carry signals to the brain and we sense tingling. It's kind of like when you're hearing some static because you're too far from the broadcasting station. Numbness is when the nerves can't send or relay signals and you've lost a type of sensation. So this would be like if you pick up a cold soda can, but you can't feel the smoothness or the coldness of the can. Or if you're walking on a carpet and you can't feel the texture of the carpet or the temperature of the floor through your feet. Nerve imbalance or clumsiness can happen if you can't keep track of your hands or feet. So your hands or feet are somewhere, but it's not sending signals to your brain of where you're located. And then you will not be as coordinated. And this is predominant, especially in the dark. Pain, if the nerve is damaged from peripheral neuropathy, you can have pain like I've described before, either more intense or easily, or if the nerves die, then you won't have any pain. That's the numbness. And then pain symptoms can also occur spontaneously, or ghost pain can happen where the nerves are trying to wake up and send signals, and you will develop pain syndrome, and that's the neuropathic pain. The autonomic nervous system, in the picture that I described before, excess sweating, heat intolerance, inability to expand or contract the blood vessels that help the blood pressure, GI symptoms, even difficulty swallowing. This is rare, but a lot of you have told me, my feet are numb or tingling, or I get these weird sensations. And then I'm asking about neck pain or trouble swallowing. And you're like, hey, I'm talking about my feet here. Why are you going up here? Well, now you know why. So, what are some causes of peripheral neuropathy? Well, the number one cause in medicine is type 2 diabetes. And and it's usually unmanaged type 2 diabetes. It's when the blood sugar is too high for too long, it damages the peripheral nerves. So, imagine your blood, which is the circulation that goes all the way to the tips of your toes. If it's filled with sugar, that sugar that's supposed to, the nutrients that are supposed to nourish those nerves at the tip of your toes are blocked by sugar. There's so much sugar that the vitamin B12, that the iron, that the other micronutrients that are supposed to help your nerves stay healthy are blocked by the sugar. And that sugar will just coat the nerves and damage the nerves over long periods of time. So if you think about it very mechanistically and anatomically, it makes sense why we try to keep our sugar under control. And so that you don't damage your nerves at the very tips of your toes. Alcohol, I know you guys hear me talk about it. But alcohol, if you think of it in the same way as sending sugar to the tips of your toes, if you're drinking, think of that one drink as you're sitting there having cocktail hour and nothing else. It's that alcohol is filling your bloodstream, traveling to your fingertips and the tips of your toes, and it's directly acting as a toxin on your nerves. And so it's also a very common cause of neuropathy. It can also contribute to vitamin deficiencies in and of itself. So as the alcohol is getting absorbed through the upper intestine and the stomach, it's competing, the B vitamins that you would have absorbed are going straight through you and not getting absorbed. So we see nutritional deficiencies, which lead to the next topic. Whenever folks are talking about numbness and tingling, I'm thinking of all the B vitamins that may not be entering, or if there are some copper deficiencies or vitamin E deficiencies. Now, interestingly, too much B6 can cause a neuropathy, and I've got a slide for that. Autoimmune or inflammatory conditions. So you're talking about neuropathy and the feet hurting, and I'm asking if your joints are hurting or if you're getting any rashes or other symptoms. And that's because neuropathy can happen due to hypothyroidism, lupus, rheumatoid arthritis, Sjogren's syndrome, inflammation of our bloodstream, celiac sprue, and a whole list of other conditions. So we have to think holistically when somebody describes numbness or tingling of their feet. Medications and toxins can also cause neuropathy directly just by the same mechanism I described here, by the bloodstream carrying toxins to the tiny little fibrils of nerves to the tips of your hands and feet. Chemotherapy, platinum-based therapies, vincristine, antibiotics, and I've got a whole list of things, medications for gout, exposure to some heavy metals, lead and mercury. So when folks are talking about neuropathy, I ask, are you eating, what types of fish do you eat? And we've picked up some elevated mercury levels in folks. And it seems like counterintuitive, but we know that microscopic levels of mercury can cause nerve damage in fetuses. And why wouldn't it, over prolonged periods of time, cause nerve damage to us? Industrial chemicals, exposures that you breathe in can cause neuropathy. What about tumors? Yes, cancers can independently cause neuropathy by what's called a paraneoplastic syndrome. So you may have lung cancer, but your body's efforts to fight it can send other hormones and signals that can directly damage the nerves, or even benign tumors directly in your feet or hands can pinch off the nerve and disrupt your nervous system, or nerves that are on the spine, gangliomas, can pinch that nerve and cause a neuropathy. There's also bloodstream malignancies, myeloma, or MGUS, which is monoclonal gammopathy of uncertain significance, which is can directly affect the nerves. And let's see, I'm not done. Genetic conditions inherited from your parents. Amyloidosis, Fabry's, Charcot-Marie-Tooth are common. There are treatments for these. You, as an adult, you would know if you had these by the age of 50. But I do look for amyloidosis once in a while. It's rare, but we have picked it up. Infections, nerve damage can happen because of viruses. HIV directly targets the nerves. Epstein-Barr, hepatitis C, people who've had shingles, no nerve pain, because actually the shingles virus lives in some of the bulbs of our nerves. Lyme disease can affect our nerves. Leprosy is an inflammatory infection that affects the nerves. And with shingles, you can actually have lingering nerve inflammatory pain that takes a long time to resolve. That's why folks are eager to get the shingles vaccine. Trauma and surgery. If you've been in an accident, broken a bone, damage can directly occur to the nerves. And medical procedures can hurt the nerves. So sometimes when you've had a shoulder surgery and they're moving the nerves that innervate the arm to the side so they can get into the shoulder, they can, the retraction forceps and can actually damage the nerves, and you can get additional tingling or numbness down that arm that takes a while to recover from, but you wake up. Swelling or stretching of the nerves can damage the nerves. It's usually in one location and it can be long-term or permanent. If you've got vascular circulatory insufficiency, if the blood flow is pinched, you can get neuropathy. If you've got cholesterol clogging your arteries and not delivering enough blood flow to the tips of your toes, you can develop neuropathy. So I check the pulses. So when my hands are on your feet, I'm doing a lot there, and I'm checking to make sure you've got good blood flow. We've all felt this at one point or another when we maybe sit cross-legged or our arm falls asleep, but then you get the circulation back. Idiopathic, there are often we just don't know, and it could be a multitude of the factors that I've just listed above. So let's look at some of the drugs that cause neuropathy. Heart and blood pressure drugs, amiodarone, hydralazine, perhexylene. We don't commonly use that one, but hydralazine and amiodarone are commonly used. Chemotherapy, cisplatin, docetaxel, paclitaxel, vincristine. We don't use Suramin as much anymore. Drugs used to treat autoimmune diseases, Enbrel, Remicade, Arava. Drugs used to treat seizures, carbamazepine, dilantin, phenobarbital. This is Tegretol. Anti-alcohol drugs, disulfiram, or drugs to fight HIV/AIDS. These are some antivirals. Drugs used to fight infections, chloroquine, dapsone, INH that's used to fight TB. Flagyl, we use that commonly for abdominal infections or anaerobic wounds. And nitrofurantoin, many women know this drug as macrobid or macrodantin. It can cause neuropathy. Thalidomide we don't use unless you have leprosy, which we don't see in this country. And fluoroquinolones, Cipro, Levaquin are now being implicated in neuropathy as well as memory issues. So I added that on because we're seeing a little bit more data for that. Other drugs or substances, colchicine, which we use for gout, arsenic, and gold, which are used for arsenic can be some autoimmune diseases. We use it as well as gold. Now, what about taking too much vitamin B6 from the supplements, which is pyridoxine? So we give pyridoxine if you're on INH because that depletes your B6, but if you're over supplementing, usually you can urinate out your pyridoxine or B6, but if you're just overdoing it, you can actually get lack of muscle control. You can get some skin lesions. You can get heartburn, nausea, sensitivity to sunlight. You can get numbness, and then a decreased ability to sense pain or extreme temperature. So that's why I'm checking your Bs. Let's talk about mercury, because I do see that elevation in our office. Exposure to, and this is directly off the EPA's website. Exposure to mercury most commonly occurs when people eat kinds of fish and shellfish that have high levels of methyl mercury in their tissues. Almost all people have at least some small amounts of methyl mercury in their bodies. So it tells us that there's a lot of methyl mercury in the environment. Data shows that most people have blood mercury levels below levels associated with possible health effects. So it's hard to pinpoint how high the level needs to be before it's a toxin. But we do know enough about methyl mercury levels in pregnant women and how it affects our developing fetus. And those levels are less than 1.0. And if that goes to the fetus, it is a neurotoxin. And I've seen levels above 13 in our office. Exposed to high levels greater than 50 can lead to peripheral vision loss, pins and needle feelings in the hands, feet, maybe around the mouth, sometimes muscle incoordination, speech, hearing, walking, and or weakness. It's very hard to know that. I have not seen levels above 50. Now let's talk about alcohol, and how does that impact our little neurons? So alcohol directly bathes the nerve cells and acts as a direct toxin onto the nerves. And the nerves are protected by a sheath called myelin. And what alcohol does, just as, we use alcohol to wipe off wounds and sterilize things, right? So, it's got kind of an acidic type of milieu. So alcohol breaks down this protective sheath, and then that can disrupt our transmission of electrical impulses and lead to neuropathy. And if you look at this image, I chose this image because there's not much food in front of them. And so then this actually will directly be delivered via the bloodstream and act as a toxin, whether it's just half a glass or not. So what would you do? So you come in, describe numbness, tingling, pins and needles, burning. Well, we do a whole host of blood tests. Many I've already done on many of you already. And then we test for heavy metals like copper, mercury, lead. Sometimes we look for proteins in the urine, look for the myeloma or MGUS, look for glucose spilling into your urine, telling us that there's too much. Then we would refer you to a neurologist if all of this is normal and there's no signal that this is just on one side. So we might examine the cervical spine of the neck or do a brain MRI. Anybody who complains of numbness, tingling, I'm thinking first brain, spine, extremity, so that we eliminate something that we can actually fix through surgery. Then if all of this is negative, this is normal, then a neurologist would test your muscle. They would do pins and needle tests to see, are the signals being transmitted back and forth? They may ultrasound a nerve. They may do genetic testing, or we may do it. There may be, if there's autonomic complaints of lightheaded or dizzy symptoms or sweating, they may do a Q-sweat test and stimulate the sweat glands and see if it's overproducing, producing, do some heart rate variability studies. Even all last, if you're having weakness or a muscle is weakening or shrinking, then a nerve biopsy would be indicated. Here is what the neurologist is thinking when they see you. I just wanted you to get a picture of everything in their brain as they're moving forward, trying to figure out your neuropathy. Very commonly, I refer a person to neurology and a bunch of tests are ordered and it overwhelms you all. But I want you to see how complex that numbness and tingling process is for us to think through and sort out so that we can address the issue directly. So sometimes we may end up sending you to a variety of different consults, a neurologist, sometimes a chronic pain doctor, physical therapy, occupational therapy to then wake up the motor signals, an endocrinologist to make sure that there isn't any hormonal reasons that you're having neuropathy, rheumatologist to make sure there isn't an autoimmune reason. If there are alcohol dependence issues, then addiction medicine. If one of the infectious disease tests like EBV or some, TB or something, then we may end up needing an ID specialist. If we find a neuroma or a tumor, we'd send you to the surgeon to get rid of it. And then the neuropathy hopefully will improve over time. And if one of the blood tests for cancer comes up positive, you'd need a blood specialist. So it's sometimes something that you've lived with for a long time and you describe to me opens this whole slew of thought process. I hope you appreciate the complexity of that complaint and why we need to sort this through. So treatment, how is it treated? Well, as you could tell, the treatment is as complex as the source. There are medications that can treat the peripheral nervous system problems. They come in injections, pills, patches, slow release medications like gabapentin or Lyrica, topical creams, or gels. Physical therapy can help wake up our nerves or learn adaptation to different nervous system changes to improve our balance and prevent falls. Surgery, like I mentioned before. There are some wearable equipment and devices, braces, canes, walker, footwear that can help improve our balance, even if we have developed neuropathy, especially for diabetics. There's a lot of research on this one that will help our diabetics improve their sensations and balance. Podiatry and foot care is very important if we have peripheral neuropathy because it can change our bones. It could create sores, infection, especially in diabetics. Sorry about that. And then other pain treatment, sometimes acupuncture, transcutaneous nerve stimulation, injections, rarely a spinal cord stimulator. So what's the most common treatment? Well, there's no one common treatment. It depends on what's causing it and the symptoms you're experiencing. Some are treatable, others we can just try to take the edge off of your symptoms. How can I reduce my risk of development of neuropathy or prevent it entirely? So many folks who are on the line don't have it, but they would say, I don't want it. I know I have a friend who has it. Well, make sure you're not having any vitamin deficiencies. B12 deficiency is a very common source of neuropathy. I am checking it in almost everybody with your annual lab work. And interestingly, in the United States, our range for normal B12 is 192 to 900. That's a huge range for normal. Now, how did the normal range get invented or created in lab tests? Well, that normal range was randomly chosen of 1,000 people off the street walking along, and they did blood draws and they checked their B12 level. And that 1,000 people had a range between 192 and 900, and that became the normal range. It's hard to know how many of them were walking around with neuropathy or some tingling. They may have ignored it. And so in Japan and some other countries, there's actually a movement to make 300 to 900 be the new normal range. So I've got folks now who are in the 200s or 300 or 305, and I will say that's a relatively low B12, and we'll try to boost you up, tell you to take a supplement. Other vitamins like B6 are toxic, and we measure that. Stay physically active and try to maintain a healthy weight. Diet, exercise helps reduce our sugar, so that you don't have neuropathy over time. It improves our blood flow to our feet and hands so that you can get good blood flow and nutrients to the tips of your fingertips and toes. I can tell you right now, just by me keeping my hands elevated like this during this entire 30 minutes, I can feel just a teeny tingling. So that's normal, and we just put our hands down. Wearing safety equipment. So injuries are a major source of nerve damage. Using safety equipment with, say, you're working with your hands or repetitive hammering can help protect you from these injuries. And also, if you are on the computer a lot, think about a soft keyboard or support for your mouse. Managing chronic conditions. So if you have any of the disease entities described, keeping that under control, keeping your inflammation under control minimizes peripheral nerve damage. Avoiding alcohol in excess or for long periods of time reduces your risk of neuropathy. And my recommendation is hydrate in between. If alcohol is going to get to your feet directly through your bloodstream, then make sure that you've eaten vegetables in or some, don't drink on an empty stomach so that it doesn't directly get to your nerves. Avoid exposure to toxins, poisons, heavy metals. Mercury is our very common one. Older homes have lead-based paint. You can check for those. So this is a recommendation I received this week from a patient. There are these socks by Naboso. This total disclaimer is that this has not been medically proven, but it does make sense for some folks. If you've got some numbness associated with your neuropathy, by stimulating, these have like little bubbles inside the socks that then stimulate you. And what that will do is then help send signals to your brain that will then send signals back to help you maintain your balance and maybe improve that mobility and strength. So some folks with neuropathy that's numbness associated really find a benefit by getting extra stimulation. It helps their nerves wake up, so to speak. Research. There's a ton of research being done on neuropathy through the NIH. There are NIH consortiums of groups of academic medical centers looking for genetic mutations since they're rare. They develop these medical centers that work together. You can look online. If any of you have these genetic issues, your family members will know it. You'll discuss it, share it. We now have genetic panels we can order. The demyelinating processes are an important aspect as well, and that's being studied. Inflammatory neuropathy, such as Guillain-Barré, which is sometimes an autoimmune reaction or an immune reaction. We commonly have heard about it after a vaccine, and our body will, even like a flu shot, can cause a Guillain-Barré syndrome or some chronic demyelinating polyneuropathy where our immune system mistakenly attacks our nerves. So there's some more studies being done about that. Interestingly, there's also stem cell studies being researched to see if we can help engineer cells to then hopefully put it back into those nerves to help them regrow and regenerate. So this is an exciting time. There's a lot of people affected by this, and the NIH is very interested in it. Here are some resources for you all on this topic, and it will be available to you by slides or on the YouTube video. The Foundation for Peripheral Neuropathy has a lot of information for patients. And then the American Diabetes Association, if you have diabetes. And these are the two sources that I would look at, as well as the NIH website, which is where I obtained much of this information and hopefully have helped elaborate on their terminology more visually for you. So with that, I thank you, and we'll open this